Mike from Lundquist Chiro Sports. Today we're going to be talking about a condition we see consistently in the office, which is an anterior pelvic tilt. Happens a lot with people who sit all the time, as well as runners and many different athletes. End up getting tight hip flexors, which causes the pelvis to tip forward, increasing the low back curve, causing jamming of the facets in the lower back, ending up causing lower back pain. So what we're going to talk about today is some home care to work on releasing the hip flexors so we get better flexibility and mobility there. So Ryan's going to come over here. He's going to just take a knee, and we're going to go through the first stretch, which is just a simple hip flexor stretch. A couple key components here. We want to make sure we've got 90 degrees at the knee. We want to make sure that that knee is not out over the toe. We also want to make sure we've got 90 degrees at the back leg. He's firing his stomach so that his lower back is not arched. We don't want to exaggerate that low back curve any more than we need to. And from this position, he's just simply going to lean forward, and he's going to feel that pull all the way through that front side of the down leg. If he needs to get a little more stretch, he can lift this arm up over his head and just gently lean away from the knee that's down. Again, increasing the stretch and pull through the hip flexor. I recommend 3 or 4 good deep breaths in each position, and then go to the opposite leg. Another thing we can do is a little relaxation technique utilizing the classic foam roll and a band of any kind. And so what we're going to do here, we're going to take the band, we're going to put it around Ryan's foot. We're going to lock it in here so that it doesn't slip on him. And I'm going to give him this to hold on to. We're going to put the foam roll underneath his knee. So now what he's going to do in this position is there's slack here. He's not pulling on the band, but what he's going to do is he's going to drive his knee down into that foam roller. He's pushing, activating that hip flexor. He's going to count to 8. After that 8 count, he's going to relax. Then he's going to pull the band and get a stretch into that hip flexor. He's firing his stomach. He's trying to prevent that lower back from becoming too arched at this time. And then he's going to relax after an 8 count. And he's going to press down again. He's going to fire that knee into the foam roller, activating all these muscle groups on the front side that are part of the hip flexor group. He's going to relax, and he's going to pull with that band, trying to keep that leg steady. What we don't want to see is that leg elevating. As he elevates his leg into the air, it increases that low back tension, which is going to be counterproductive to what we're trying to do. This is a great way to work on relaxing your hip flexors. If you spend a lot of time sitting in an office chair, if you're a long distance runner, if you do sprints, if you have low back pain when you're doing any type of athletic activity, this is a great drill for you to go through. Look forward to talking to you next time.